Over the years, athletes have gotten bigger, stronger, and more physical, which leads to a greater risk of injury. Along with physical change from an injury, psychological changes may also appear. Each athlete will respond to an injury in their own way. There are two major types of injuries, acute and chronic. Acute injuries occur suddenly from a specific event during exercise. Chronic injuries are repetitive injuries that occur over a prolonged period of time and gradually become more severe.
Yeah, it was a bad day. I had a bad day. Shattered my tibia plateau into 30 pieces.
5 knee surgeries, 1 ankle surgery, and 6 broken vertebrae.
Shattering my eye socket, there was blood everywhere.
Did a front flip going about 70 and tore my Achilles.
When I looked down, after bouncing off the pads, my blade was stuck in my leg. The point that it hit went directly into the muscle, all the way to the bone.
I shattered both of my feet. I tore ligaments, I broke them, I dislocated my left foot, and it was really just a total disaster.
I was hit by a bobsled going into the 2006 Bigs.
Tore my MCL and ACL, and then I had a small tibial plateau fracture.
I was in Park City, Utah, working on double backflips and just threw it too hard.
The course was great, and then the fog rolled in, and we just had delay after delay after delay.
5 months before opening ceremonies, I was sitting on the ice after falling into the boards.
Ended up landing in a way that my knee just kind of went straight to my face. Right away, I knew that this was a serious injury because I had never really experienced anything like it before.
I went off the jump, went a little bit too far, landed in some soft snow, and my ski stopped and my knee completely buckled.
I pulled my blade out and I looked down and there was this gash about, I don't know, say like this big in my leg. And then I saw blood flowing. I'm like, man, you might die right here. And then it sunk in, you know. My parents were behind me, directly behind me in the section that I fell in. My mom was like blood-curdling screams right into my ear. So I was just like, at that moment, I really thought I was done.
I had to have a plate and 5 screws in my left leg. And then shortly after that, I shattered my right tibia plateau and broke my tibia. It's been a lot of ups and downs in the past 3.5 years.
I had a lot of struggle with fear. I fought fears quite frequently. I wasn't confident pushing out of the gate. A lot of the stuff we ski down is just pretty much a sheet of ice and it's really steep. And knowing if I crash, I can do something like that again.
You know, I had to ask myself if I wanted to keep going because I've been doing it a long time.
I'm not gonna lie, I had a lot of thoughts in my head that were just like, what are you doing? Why are you still doing this? This isn't that fun.
After this last injury, I was determined I would never race again. Laying in the hospital and realizing that I had to go through this whole rehab process again, it seemed just too much at the time.
While I was on my way to the emergency room, I told my coach this definitely wasn't worth it.
What's helped me persist is just the love of the sport. I love skiing. I love being in the mountains and the freedom I experience while skiing. That's what drives me to race and still risk myself.
I love to snowboard and I love to push myself physically and mentally, and I love to hit for my full potential, and I feel like I still have more to give.
I think the main thing is my love for the sport. I have a lot of passion for it, and I don't want to leave on a bad note. I want to leave knowing that I did everything I could to be the best that I could have been.
Life is all about obstacles and jumping over them and really figuring out and honing in on your person. And I know it sounds crazy, but it really made me realize who I am and appreciate my life even, that much more.
I'm doing everything I'm supposed to. I'm working really hard. I'm doing therapy every single day, and I have no doubt that I'll be ready and prepared by the time Sochi comes around.
Acute injuries are a sudden injury that is usually associated with a traumatic event such as clashing into another player during sports or a fall from a bike. Your body undergoes changes during this period, and it is often a negative one. A traumatic impact can cause your bone to crack, muscles to tear, or ligaments to snap.
Chronic injuries are most commonly known as overuse injuries. These type of injuries are caused by overuse of a particular part of your body through sports or exercise. Chronic injuries develop slowly and last a significant amount of time. Symptoms of chronic injuries are most often mild compared to acute injuries. At the beginning of this type of injury, the pain may be dull, which makes a person ignore the injury. Over time, the injury may become more painful and will eventually cause more issues. Definite symptoms of chronic injuries include pain while participating in sports, swelling after each game or event, and/or constant aching when resting. Psychological effects come with any type of injury, but studies have shown that chronic injuries have a greater effect emotionally on a person than acute injuries. Chronically injured athletes show more tension, depression, and anger. Other psychological effects may be disbelief, shock, or fear.
The Western Journal of Medicine did a study on 280 elite athletes in men's and women's tennis, swimming, water polo, track and field, volleyball, men's football, gymnastics, baseball, women's softball, field hockey, and lacrosse in the NCAA. Out of those 280 athletes, 134 were considered injured. From those, 9 men and 8 women had an acute injury. Western Journal of Medicine decided that an acute injury was having a problem for less than 7 days or had just gotten surgery. The rest of the injured athletes, 117, had a chronic injury. Of those, 72 were women and 45 men. The Western Journal found that of the chronic injuries, 29% was in the shoulder, 20% in the knee, 11% for the ankle, and 40% in other, including soft tissue, back, elbow, foot, wrist, hand, neck, shin splints, and hip disorders.
Overall, injured athletes showed greater negative attitude, lower self-esteem, and higher levels of depression and anxiety. It is even said that injured athletes express some of the common reactions seen in trauma victims, which include fear, anxiety, avoidance, anger, irritability, grief, and depression. Overcoming physical injury along with psychological emotion may be difficult, but with support from family and friends and an inner mental drive, any injury, acute or chronic, can't keep you from achieving your dreams.